Hi, my name is Dr. Sunny Patel here at Briarcliff Dental Group. I wanted to take a little bit of time today to discuss the most common thing that we see in our office, cavities. A tooth cavity develops from bacteria and acid. Together, that recipe creates a soft spot or a weak spot in the tooth that ends up growing and creating an active hole in the tooth. Traditionally, we have always told patients, brush and floss and you won't get cavities. We know there's more to that story now. Oftentimes, medication, dry mouth, clenching and brushing your teeth, and even diet, external acid or internal acid from acid reflux, all these factors together can really impact a patient's ability to develop cavities. Cavities should be something that are dealt with as early as possible. When we're able to deal with the cavity in a very early manner, in a very shallow manner, then there's really nothing to worry about. That treatment includes doing fillings. As restorations need to be bigger with bigger cavities, it involves more and extensive treatment. Typically, when a cavity starts to hurt, it means that a cavity has no longer remained in the enamel itself. It has gotten into the inner structure of the dentin of the tooth. If it starts to get deeper and starts to touch the nerve of the tooth, then the tooth will require a root canal or nerve therapy to stop the pain associated with the cavity. Even though a cavity may start to hurt, there may be some very conservative ways to treat that. It really depends on taking an x-ray and seeing the depth of the cavity itself. It is one of the main reasons why we encourage to treat a cavity as early as possible. The way that we treat cavities is by depth. A shallow cavity can be treated with a simple resin filling in our office, whereas a deeper filling or a more broad, extensive filling may require an indirect restoration, ranging from an onlay, a crown, and sometimes even a conservative inlay can do the trick. Once you've had a cavity and the restoration has been completed, it is possible to get a new cavity underneath it if we're not able to clean properly around it, if we're not able to maintain and watch that restoration over a period of time with periodic x-rays and doctor exams. But it is important to always maintain a cavity filling or a crown or any sort of restoration in the mouth with the same diligence and care that we would use for our natural teeth. Prevention is one of the biggest things that we talk about when addressing cavities. Because cavities come from more now than just brushing and flossing, we know that we need to address all the different avenues which may lead a patient to needing cavity fill. Looking at medications, addressing dry mouth, addressing bruxing and clenching, and even addressing external acids from foods that we eat, things that we drink, all will be vital to preventing cavities. Here at our office, we love to sit and come up with a thorough diagnosis and a thorough plan for preventing cavities and attacking all of these different areas that may be contributing. If you feel that you have a dental cavity or have had dental cavity treatment in the past and would like us to take a look and evaluate your risk, please do not hesitate to give us a call at 404-633-9663. Our doctors would love to sit and talk with you about your risk factors and how we can prevent cavities.